Greetings. Welcome to 40 Weeks, a newly formed series on Black Women's Health podcast where we answer questions about your pregnancy. Questions that you may have asked and never had answered. I'm Dr. Rahman. I'm a board certified OBGYN, and we're here for you. We want to help to eliminate maternal racial health disparities and to decrease maternal mortality in the US. Today, we're going to discuss something very basic: prenatal labs. Why do we need them? No one likes being stuck for blood or poked and prodded. No one enjoys this. Is it necessary? And what does it tell us? Listen to the questions, and the answers will tell you why prenatal labs are necessary. What is her blood type? Why do you need to know this? Her blood volume increases during pregnancy, and she could bleed while pregnant, during delivery, postpartum. She could bleed excessively, and we need to be able to give her blood if that should happen. Is she infected? At the first visit and at other times throughout the pregnancy, we have to know, we have to ask the question, we have to do the testing. We test her urine for a UTI, urinary tract infection. We test for sexually transmitted infections, including gonorrhea, chlamydia, hepatitis, syphilis, HIV, and beta strep. Does she have immunity against the virus? And no, I am not talking about COVID. We're checking for immunity, protection against rubella, otherwise known as German measles. It's a virus. If you contracted this virus during pregnancy, you're at an increased risk for miscarriage or stillborn. If the baby doesn't die, the baby's at risk for severe birth defects. The most severe damage occurs during the first 12 weeks. Does she have any easily identifiable medical problems? Is she anemic? Low blood? Has she developed gestational diabetes? Does she show evidence of protein in her urine? Or do the recent FDA approved tests show that she's at an increased risk for severe preeclampsia? Is the baby at risk for an inherited genetic or a chromosomal abnormality? You want to know, is my baby okay? Does my baby have birth defects? Or has my baby inherited a genetic disorder such as cystic fibrosis or Tay-Sachs disease or sickle cell anemia or chromosomal abnormalities such as Down syndrome? Both screening and diagnostic testing is available prenatally. The question is, what would you do if you had an affected child? Would you terminate the pregnancy? Honestly, most of us don't question if we should get prenatal labs. We get the tests done. We get them done even though we don't necessarily know why they were done or understand the results or even ask for explanations. And if we want maternal health to improve, if we want to decrease maternal mortality, if we want to eliminate racial health disparities, we have to assume some responsibility in our prenatal care. And part of it begins with knowing and understanding your prenatal labs.